Hello and welcome to the Midwest Specialty Surgery Center. I'm Dr. Josh Carter, a fellowship-trained hip and knee surgeon at the Midwest Center for Joint Replacement. We're honored to be part of your team. And while we perform many types of operations here at the surgery center, we specialize in doing outpatient hip and knee replacement surgeries. You know, it wasn't long ago that a joint replacement operation required a 3, 5, maybe even 7-day stay at a hospital. But here at MSSC, we have pioneered protocols and techniques to allow for joint replacement surgeries to be done safely and with adequate pain control so that you can go home and recover in the safety of your own home. This has enabled thousands of our patients to go home on the same day as their operation. We're passionate about taking the pain out of joint replacement operations for everyone involved. So we've created a few short videos to help walk you through the process of the outpatient joint replacement system. We'll start talking about the pre-operative process, which means the steps that you need to take before the day of the operation. And Sarah will start us off with that.
Hi, my name is Sarah. I'm one of the nurses that work at the surgery center you've scheduled surgery. Once you've scheduled your surgery, one of the nurses here will be in contact with you for a thorough medical history. This medical history is usually done within the month prior to your surgery. Depending on each person's medical history, some patients will require medical clearance from one or more doctors that you see outside of our facility. This is decided individually based on your medical history. During the phone call, we will obtain a thorough medical history, including a complete medication list. This list will need to include all pills that are being taken, prescription and over-the-counter. Once this list is obtained, we will give you instructions on which medications need to be held prior to surgery and which medications we will ask you to take the morning of your surgery. The most common medications that are held prior to your surgery are anti-inflammatories, vitamins, supplements, and any aspirin-like product. If you are taking a prescription blood thinner like Plavix, Xarelto, or Coumadin, you will need to notify that doctor that prescribes the medication and get instructions on when it is safe for you to stop these. These medications will be stopped based on your history. In addition to your normal medications, your surgeon might give you up to 3 new prescriptions to take prior to surgery. These medications are usually taken the day prior and the morning of your surgery. As you're preparing your home for surgery, things that you want to consider is where will you be after surgery? Are you hanging out in the living room or the bedroom? When you choose these areas, please clear all clutter from those rooms, as well as any floor rugs. This makes it easier for you to get around and less likely for you to trip. The best place for you to relax is in a bed or on a chair or couch with an ottoman or stool in front of you. Recliners are usually not the best, as they're hard to get out of after your surgery. All patients approaching surgery get very curious about their surgery time. Please know that we will call you prior to surgery to tell you when that time is. The phone call does come from your surgeon's team, and they will call you 1 to 2 days before surgery, but that phone call often comes after 4 p.m. the night prior. Please don't fret, we will get a hold of you. If you are concerned, please make sure that the surgeon's office has the best phone number for you, and that way they can get a hold of you easiest. The night prior to your surgery, you will need to use the wipes that are in the back of your binder. The night before, we do ask that you take a normal shower using your normal soaps. Once you get out from the shower, please dry completely off and use 1 package of wipes from your belly button all the way down to your feet on both sides. Please put on clean pajamas and go to bed in clean sheets. We do ask you to change those the night prior so that they are clean and that you don't have to worry about it for a few days. Also, we do ask that you remove any pets from your bed from the night before to 2 weeks after your surgery. All patients are asked to not have anything to eat or drink after midnight the day of your surgery. The only thing by mouth taken will be enough water to get any medications down. Otherwise, please nothing. That does include no mints, gum, candy, or any tobacco products. After the morning when you get up, you will have medications to take, as well as a second package of those wipes. We ask you to use those wipes from your belly button to your feet without taking a shower. Please do not shower. When you get dressed to come to see us, please wear pajamas, sweats, shorts, something that's loose fitting and elastic waist is usually the best. Please do not wear yoga pants or tight pants, as we cannot get those over your dressing. When you head to see us at the surgery center, you will need to bring an adult with you who's over the age of 18. This person will be responsible for your discharge and be with you for at least the first 24 hours after your release from us. After this first 24 hours, the requirement for a caregiver is up to you and your safety and how you feel. Other than your driver, a few things that you need to bring with you to the surgery center is a photo ID, your insurance card, and a walker. We do require all patients to start their recovery on a walker, and then they may transition to a crutch or cane a few days afterwards. Some people use this for a day or two, others use it for the average 2 to 3 weeks. If you do not have one of those, you can contact friends, family, or there are facilities that rent them. If you have any questions prior to your surgery after we've already discussed all of this on the telephone, please do not hesitate to give the surgery center or the surgeon's office a phone call.